to Pia and Kim Talk Voice. My name is Kimberly Brownell, and I'm a speech pathologist with ENT and Allergy Associates, and I'm specialized in the voice box.
My name is Pia Viana. I am a speech pathologist as well with ENT and Allergy, and I specialize in the voice box too.
So let's go ahead, without further ado, let's start you on some great voice exercises.
Well, before we talk about voice, we must talk about breathing.
Yes, of course. You're right, Pia. You're right. Breathing is fundamental to a great voice. In fact, the voice is not just about the voice box. It's also about the power supplying air to the voice box to get those vocal cords in motion, as well as what happens after, which is what we would call the filter. So that provides resonance and the ability to project your voice and shape different sounds. So breathing is absolutely essential to a good voice.
It sure is. The respiratory system can be really complicated, but we're going to keep it super simple today. And we're just going to remind you that you breathe in through your nose, you take air in through your nose, you breathe into your lower abdomen or into your lungs, and then we speak on the exhale. You really need that breath support for quality voice or quality sound.
Exactly. So for example, I've got this pinwheel here. If I use a minimal amount of air, this pinwheel is not going to be set into motion. It's barely moving. But also, if I use too much air, so there's still an imbalance, it's not going to move the way I want it to as well.
It's all uncoordinated.
But if I use the right amount of air, I can keep it going.
Perfect.
So the question is, Pia, who needs to learn about breathing for voice?
Everybody needs to learn about breathing. However, people that use their voice professionally or use their voice for purpose really need to work on breath support or work on breath work.
That's right. So let's get started with some breathing exercises. Very basic, very simple. You can do this at home. So I have a flower and a candle to demonstrate. I'm going to imagine smelling this flower, so I've got a nice, easy breath in through the nose, and then blowing out a candle through pursed lips. So if you would hold this candle for me, I'm going to demonstrate. Just like that. It's that simple, but practicing at home and getting better at it will have you get a better voice with better breath support.
It's really important to practice, and the best way to practice is to understand how it really works. So when we take a breath in, it's very similar to a balloon. We breathe in and we fill up our lungs with air, and then when we breathe out, we let the air out. So I like to use one hand on my chest and one hand on my lower abdomen to remind myself I really don't want to see too much movement here. I want most of my movement here. So I breathe in through the nose, and my stomach goes out. I breathe out through pursed lips, and my stomach goes in. So I used a S. You can use pursed lips on your exhale. You can use a S. You can use a F. So once again, I breathe in through my nose. I breathe out. A great way to practice this is when you're lying in bed in the morning and the night. It's just easier to visualize it. If you have something, a book or a box of tissues on your nightstand, you can breathe in, watch the box of tissues or the book rise, breathe out, watch it fall. And you just practice this for like 1 to 2 minutes twice a day, and you should be good to go.
Great. And a few other tips before we're done. When you're doing the inhale, it should be about 25% of the full breath overall. The exhale should be about 3 times as long, so about 75%. So again, and then much longer. You want to make sure that you're using a medium breath. You're not breathing in deep. If you do, you might notice that you get a little bit lightheaded. And then the last tip is to just make sure you're breathing continuously. So you're breathing in and you're not holding the breath. You're going right into the exhale. So that's about it, right?
Yeah, you should practice this right now for a minute or two.
Great. Stay tuned for our next episode.